Hello everyone, it's around that time again every year in March. Remember, one of the most devastating condition or disease that mankind has ever faced, tuberculosis, commonly abbreviated as TB. On the 24th of March every year, the world remembers this disease condition called tuberculosis. For this year, we shall take this opportunity to remind ourselves about what this condition is and what we need to do about it. So tuberculosis is a germ, and the disease, tuberculosis as a disease, is a disease that comes as a result of somebody getting exposed and getting infected with a germ called TB. This germ is very common in the environment, and it's one type of a bacteria that is present in the environment. We tend to get exposed to this germ in crowded places such as markets, shopping malls, churches, and also in hospitals and clinics when patients come to our places of work. And for that reason, we try to ensure that there is ventilation and we minimize overcrowding in such places. And if we are to prevent TB, we need the public to be aware of these risks that people normally get to be exposed to tuberculosis. Of course, not everybody that gets exposed to TB germ gets the TB disease. And why? It's because we are unique. Some people get exposed and the body just gets the infection, and they never get to get the symptoms and signs of tuberculosis as a disease. There are those people who get exposed and the infection goes on and causes a disease called tuberculosis, which will make you get cough, fever, weight loss, and many other symptoms. The common symptom is cough. 85% of patients who have TB, the TB is in the lung. And when the tuberculosis is in the lung, you get to have cough as one of the symptoms that you develop. But you can also get tuberculosis in the bones, in the intestines, in the ovaries, in the kidneys, the skin, the brain, the heart, the eyes. So it can affect any organ in the body. Our concern from a public health perspective is the disease that affects the lung, because it's the people who cough that disseminate the disease. So for that matter, when you come to the hospital and we ask you questions like, do you have a cough? It's because we are trying to screen for tuberculosis. So tuberculosis, you can have tuberculosis and not necessarily have a cough, because we assume that the TB is in the lung. But if you have the TB germ in the kidney, in the liver, in the brain, in the heart, you may not have cough. Secondly, because of these issues, we have taken a deliberate effort to try and prevent tuberculosis. Our plea to the public is that if you have a cough for more than 2 weeks, please ask your healthcare worker to screen for tuberculosis. The tests that we use to screen for tuberculosis are widely available in most clinics, health centers, and hospitals. So please ask for your healthcare worker to test for tuberculosis. They are most likely going to ask you to provide the 2 sputum samples, preferably early morning samples, that we use to test tuberculosis. The tests have improved. They are very quick, very accurate, and very sensitive. So please give us a chance. Why do we screen for tuberculosis? That's the most practical opportunity we have for us to spread the disease, because when we detect tuberculosis early, we treat you and you'll be cured. If we delay to detect tuberculosis, somebody can move around spreading tuberculosis for over a year. You can cough and still move, work, and yet you have tuberculosis. If we do not screen you and pick you quickly and start you on treatment, you'll continue spreading this germ to other people in the places where you'll go, either in church, in a taxi, at your workplace, or even when you have escorted your family members to hospital. So it's very important that we screen. So as a country and as the World Health Organization recommends, we really need to celebrate this day, because it gives us a chance to remember the condition, but also gives us a chance to celebrate what we have achieved so far. So moving forward, this year, as we celebrate tuberculosis, with the theme that has been given to us in this world, we believe TB can be eliminated. But for us to be able to do that, on the side of us health workers, we need to quickly screen and detect and treat patients who have tuberculosis. At the community, people in the community need to be aware of the signs and symptoms of the tuberculosis so that they can come and we detect or screen and give them treatment before they spread tuberculosis to their loved ones and their friends. As a country, we urge the government to continue committing resources, especially medicines and the tools that we use to diagnose tuberculosis. And of course, advocating for people to be aware and raising awareness in the communities about tuberculosis. So with this theme that has been given to us, if we collectively put into action and implement what we already have, we should be able to eliminate tuberculosis in the world. The medicines for treatment of tuberculosis in Uganda are free. These drugs are available in all health centers that are registered to treat patients, and they are provided for by the government of Uganda. Even in private hospitals like Nakasero Hospital, we have access to these drugs from the national medical stores, and we give them to our patients at no cost. So the treatment is available. So please come for screening so that we can detect and treat tuberculosis. That is one of the ways we have to eliminate tuberculosis, because once we eliminate the germ, then the environment is clean. There will be nothing to transmit and there will be nothing to be infected with.